doctors and nurses. Today, April 15, 2021, our patient is Paz Reyes, 30 years old, from Manila, who is scheduled for radical hyperectomy.
Everyone, is everybody ready to sign in? Good morning, ma'am. How are you?
I'm fine.
Can I check your wristband? What is your name?
I am Paz Reyes,
Date of birth?
22 March 1968.
What surgery are you here for?
I'm here for my radical hysterectomy.
Okay, thank you. Dr. Dulay, is the site marked?
Yes.
Dr. De Vera, is the anesthesia safety check complete?
The anesthesia safety check is complete. The pulse oximeter on the patient is connected and functioning. The patient has no known allergy. I will be doing the anesthesia to the patient.
Dr. De Vera, is there an airway difficulty, risk for aspiration?
There might be an airway difficulty due to loss of blood and under operation.
Dr. Dulay, is there risk for greater than 500 ml blood loss?
There is a risk for hemorrhage due to too much loss of blood.
Thank you, doctors and nurses. Sign in is complete. Excuse me, doctors and nurses, ready for timeout. Surgical team members, please introduce yourself by name and by role.
Good morning, I am Nurse Cecile De Castro as the scrub nurse.
I am Dr. Cristal Dulay, your surgeon.
I am Nurse Giovanna Coloma as a circulating nurse.
I am Gob, your anesthesiologist.
Dr. Dulay, kindly verbally confirm the patient's name, the site, and the procedure.
Patient's name is Paz Reyes. I am performing radical hyperectomy and the site is marked and visible.
Doctor, what are the critical or unexpected steps, operative duration, anticipated blood loss?
Radical hyperectomy is generally performed for cervical cancer and it requires a larger resection to remove lymph nodes and parametrium. This larger resection results in a more significant amount of blood loss, and radical hyperectomies have recently been successfully accomplished with a laparoscopic approach, and this operation might last for 24 hours or less.
Dr. De Vera, are there any patient-specific concern?
There is no any patient-specific concerns.
Okay. Nurse De Castro, has sterility been confirmed? Are there any equipment issue or concerns?
Sterility is complete and all materials and equipment is ready to use and available. Cefuroxime was given within 60 minutes and metronidazole was started.
Thank you, doctors and nurses. Timeout is complete. Excuse me, doctors and nurses. Ready for sign out. The performed procedure is radical hysterectomy.
All instrument, needles, and sponges are counted and complete. The specimen include uterus, cervix, and fallopian tube for permanent.
Dr. Dulay and Dr. De Vera, are there any equipment problems to be addressed?
Nothing is missing that could have made the procedure better for instrumentation and equipment.
Okay, doctors and nurses, are there any key concerns for the recovery and management of the patient?
This is the general anesthesia. We have about 1,300 of crystalloid and urine output was about 200 millimeters. And estimated blood loss was about 100. No key concerns. The patient is breathing. His Analgesia is being prescribed and he can go off to recovery.
Thank you everyone. I think it went very well. Does anyone have input that could have made this case better?
Thank you, doctors and nurses. Sign out is complete.